Hello, my name is Thomas Shelton, and I'm a graduate student earning a degree as a family nurse practitioner. This quality improvement project investigated a small clinic in Grant County, Arkansas for tobacco use screening and cessation interventions. According to the CDC, tobacco use is the leading cause of preventable disease and premature death in the United States. In Arkansas, nearly 23% of all adults are smokers, with 54% being between the ages of 25 and 64. In Grant County, 18% of adults identify as tobacco users. Healthy People 2020 objectives for tobacco use seek to increase tobacco screening and tobacco cessation interventions in the primary care setting. The purpose of this project was to investigate the clinic's effectiveness in providing tobacco screening and tobacco cessation interventions. The potential revenue gained and lost from cessation counseling was also evaluated. The objectives for the project was 1, to identify tobacco users from non-tobacco users using HCPC and ICD-10 coding. 2, identify any counseling interventions that were provided using CPT codes. 3, any pharmacological interventions, specifically any prescriptions for varenicline, also known as Chantix, that was prescribed. And last, investigate the amount of lost revenue by not providing cessation counseling. To gather data, a modified algorithm derived from the Merit-Based Incentive Payment Program for tobacco screening was used. Using the clinic's electronic medical record, identification of patients age 18 and older with at least 2 patient encounters or at least 1 preventative encounter was performed to establish the eligible population. This would be the denominator in the equation. The percentage of patients age 18 years and older who were screened for tobacco use was determined from EMR records. Next, the percentage of patients age 18 and older who were screened identified as tobacco users or non-users was gathered using ICD-10 codes and HCPC codes. The percentage of patients who were screened identified as tobacco users and received tobacco cessation interventions was calculated from CPT codes 99406 and 99407 and a search for varenicline, also known as Chantix. Data completeness for both screening and cessation interventions was performed using the equation provided in the Merit-Based Incentive Program. Quality measure packet. For screening, the numerator included patients who were screened and categorized as tobacco users or non-users, patients who were not screened, and any documentation for not screening for tobacco use. The performance rate was determined by dividing the total number of patients recognized as users and non-users by the data completeness numerator minus any documented reasons for not screening. The results show that the clinic was very efficient in screening their patients for tobacco use. The clinic screened 100% of their patients. However, only 52% of the patients had any diagnosis code placed in their chart, that being either identification as a tobacco user or non-user. The clinic only counseled 34% of their tobacco-using patients. The clinic was found to be above the baseline and target goals as set forth by Healthy People 2020. As for revenue, only the fee schedules for Medicare and Medicaid were available for use. Values were calculated assuming that all patients either had Medicare or Medicaid. Counseling was provided 1,490 times, which generated a potential profit between $21,000 and $30,000. Taking into account the number of patients seen and subtracting the patients who had received counseling, lost revenue for both Medicaid and Medicare was determined. The result of this would be a potential loss from $11,000 to $30,000 to $37,000. In conclusion, the clinic performed above the national benchmarks, even screening 100% of their patients. The clinic could improve their performance by giving the patient a diagnosis code for their tobacco use or non-use. The clinic can increase their revenue by simply providing cessation counseling, even for a minimum of 3 minutes. Providers can aid the patient in quitting and improving their lifestyle by offering cessation medication.